Senator Ernst.
Thank you, Mr. Chair. Thank you, Chairman Graham, for holding a hearing on this issue as I'm traveling out across Iowa doing numerous town halls. The number one issue that's coming up with Iowans is the cost of health care. And wrapped up into that, what's their primary cost in association with health care? It's pharmaceuticals. So this has been a really big issue, and I want to thank all of our witnesses for testifying today. And what struck me, going back through some of the information we've been provided, according to the CDC, nearly half of all Americans have been prescribed some sort of prescription drug in the past month. Half of Americans. And the reasons why we need these medications, of course, will vary person to person. They could use it to manage pain after a surgery, or it could be something to manage a chronic illness like a heart disease or something very closely related to my family. I have a number of members of my family with type 1 diabetes. Since joining the Senate, I have literally heard from at least one person in every single one of our 99 counties who are struggling to make ends meet as a direct result of the cost of their medications. And the ranking member had mentioned this before. I just want to reiterate that there are Iowans who will live, deciding whether they make a mortgage payment, a car payment, or actually purchase their medication. Many of them are skipping meals. This is the real deal. I recently met an Iowan who lives with a rare genetic disorder, and he needs medication to live, and it costs him thousands of dollars. The medication costs thousands of dollars every month. Now, he does have insurance, but it is a burden on our healthcare system. So we do need robust competition. I do believe that on the drug market. That will help drive prices down. But there are some pharmaceutical companies that use regulatory and legal systems to their advantage, and they do block competition. Man, we've heard about it all day today. And often these anti-competitive practices, they are stifling competition and preventing Americans from accessing more affordable drugs. And so we've talked about the CREATES Act, the Preserve Access to Affordable Generics and Biosimilars Act, and the PACE Act. These are all things that many of us are working on together. Certainly, we would love to see some sort of solution in this area. So, Mr. Stansel, I want to start with you. In 2017, the pharmaceutical giant Allergan attempted to shield the patent for their drug Restasis by transferring it to the St. Regis tribe in New York. So I joined Senator Cotton and introduced the PACE Act, which would prohibit these types of sham transactions. The Supreme Court agreed and upheld a lower court ruling that Allergan could not transfer its patent to the St. Regis tribe. Mr. Stansel, does PhRMA agree that your member company should not be able to use sovereign immunity granted to Native American tribes to protect their patents?
We do. We do not endorse the use of tribal sovereign immunity transfers to protect patent issues.
How is it that we have companies that can find these loopholes and believe that that would be a great way to protect their interests? Have you heard from that company on why they tried to do that?
We don't have those conversations for antitrust reasons. The Pharmaceutical Research and Manufacturers of America is a trade association. We're subject to the antitrust laws, so we strictly do not get confidential information from our member companies.
Well, just on its surface, and Senator Cotton, when he brought this issue to me, it's crap. I'm sorry. It's horrible that a company would think to do this and try to protect their own interests in a drug. I'm sorry. Mr. Chairman, sorry. But truly, on its surface, it looks bad. I think it is a bad practice. Professor Carrier, would you like to visit that subject?
So I agree. There's absolutely no reason to transfer a patent to a Native American tribe just to avoid review at the patent office. Nonetheless, this goes along with what PhRMA has been saying for years, that these are death panels at the patent office, and so therefore they can do whatever they want. Also notice that this was not the only thing that Allergan did. Allergan filed multiple citizen petitions with the FDA, where the FDA got so tired of it, their response would say, as we told you last time, you don't have a claim. And so it's all together. Sure, the stuff to the tribe sounds bad, but it's all part of of what they do together to keep generics off the market.
Yeah, absolutely, and I agree. And I could dive deeper. I know that there was mention of ads on television and in magazines, and that's directed to the broader public out there. And I would think we could save some money in the pharmaceutical companies by directing those product marketing advertisements to doctors or those that are actually making those decisions with their patients rather than trying to promote it at large where folks across the United States are self-diagnosing. Maybe I have this ailment that needs to be treated with this drug. I think that's another area that we need to look into as well. But we could go on and on all day today, but thank you, Senator Graham, for hosting this hearing.